Diabetes is at epidemic proportions in our country, and the numbers don't appear to be getting any better, with more than 60% of Australians being classified as overweight or obese, which is a precursor to insulin resistance and type 2 diabetes. Diabetes is a known metabolic disease. There are two different types. Type 1 diabetes is where the pancreas fails to secrete insulin, which prevents the body from transporting glucose from the bloodstream into the muscles for storage as glycogen. This leads to elevated glucose levels, which can lead to kidney failure, heart disease, poor circulation, and can lead to amputation of limbs and blindness. Type 1 diabetes only accounts for about 10 to 15% of all diabetic diagnoses. Clients with type 1 diabetes are required to monitor their blood glucose level throughout the day and inject insulin at regular intervals to maintain their blood glucose level. The amount of insulin a type 1 diabetic takes determines how many points their blood sugar level will drop. If a diabetic takes too much insulin or takes insulin just before training, their blood sugar level could become low. This is known as hypoglycemia. Signs of hypoglycemia include disorientation, dizziness, and anxiety. They may also experience headaches. Hypoglycemic attacks are easily overcome by administering some high glycemic index carbohydrate such as lemonade or jelly beans. Type 2 diabetes occurs when a person is resistant to insulin. There is a strong association between obesity and type 2 diabetes, particularly with Western lifestyle that includes more processed foods with increased convenience. A diet high in sugar creates a steeper rise in blood sugar levels than a diet that consists of low glycemic index foods. This steeper rise in blood sugar levels requires greater amounts of insulin to be released by the pancreas in an attempt to lower the blood sugar levels. Over time, the body builds resistance to the increased levels of insulin being released, which leads to a rise in blood glucose levels, which is known as hyperglycemia. Hyperglycemia, or high blood glucose, is common in type 2 diabetics. Signs of hyperglycemia include excessive thirst and increased need to urinate, tiredness and blurry vision. They may also appear uncoordinated, be dehydrated and unusually moody. Hyperglycemia in type 2 diabetics should be managed with exercise, including cardiovascular and resistance training, and a balanced low glycemic index diet designed by a dietitian. Some training guidelines for type 1 and 2 diabetics are: perform moderate cardiovascular training most days of the week, aiming for 5 hours or more where possible. Perform strength training 2 to 3 days per week, utilising large muscle groups. Strength training should be prescribed at 2 to 3 sets of 8 to 12 repetitions. For type 1 diabetics, avoid injecting insulin immediately before a workout and avoid injecting into working muscles. Eat some moderate glycemic index carbohydrate around 60 minutes before training to allow blood glucose levels to stabilise. And monitor the blood glucose levels before and after each training session.